Greetings from New York. I hope you're all having a good morning, afternoon, evening, whichever time zone you're in. I'm Sudha Acharya, Principal Representative of All India Women's Conference to the United Nations and the Executive Director of South Asian Council for Social Services, or SACSS. Welcome to the parallel event, Working Women Under COVID-19, Unprecedented Challenges and Career Setbacks. This webinar is being hosted by All India Women's Conference, or AIWC, South Asian Council for Social Services, or SACSS, and the NGO Committee on Human Rights, New York. The webinar, presented in conjunction with the UN Commission on the Status of Women, will examine how working women have fared under COVID-19 and recommend targeted solutions. Before we start our discussion, I have to mention something that is foremost on our minds: the immeasurable pain, loss, and hardship that Ukrainian women, children, and families are going through. Our hearts go out to them. We wish them luck and strength and hope there'll be a resolution soon. It's over 2 years since COVID-19 hit the world and wreaked havoc. While innumerable lives were lost and families ruined, the impact of the pandemic was particularly harsh on women in all aspects of their lives. Today, we examine its impact on women in their working lives. Report after report has revealed that the coronavirus pandemic has disproportionately impacted women's careers. The industries hardest hit happen also to be predominantly ones in which women work, like the hospitality industry and so on. Plus, it's typically been women who've had to put their work aside to assume childcare at home. There's also a vast number of women who work in the informal sector whose jobs and lives were severely affected by the pandemic. We have fantastic panelists from India, the United States, Trinidad and Tobago, and Guyana, who have been working and helping these women and have intimate knowledge of this situation. We are eager to hear from them. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them in the Zoom chat or the Q&A box. We'll have time for questions at the end. We start off with Sheila Kakde, who is the president of All India Women's Conference, one of the oldest and most well-established organizations in India. She brings a wealth of rich experience to AWC. I've seen her in action in Mumbai and in Delhi, and she's very impressive. As someone whose passion is for women's security and the environment, we would welcome her perspective today. Sheila Kakde. Yeah. Go ahead, Sheila.
Yes. I'm just sharing my screen. Can you see my screen?
Yes, we can.
And can you hear me?
Yes.
Thank you. Namaskar from All India Women's Conference to all the sisters from various organizations who have joined globally and are connected to share their experience in facing unprecedented challenges of the COVID-19 pandemic. All India Women's Conference is a 95 years old national level organization established in 1927. Our headquarters are located in New Delhi, the capital city of India. Over a lakh of grassroots level voluntary women members of AIWC in the organized or unorganized sector through 500 branches work tirelessly for the education, emancipation, and empowerment of women across the country. Creating awareness in various fields participation in legislation, policy suggestions for women's safety, stopping atrocities, spreading communal harmony and peace, participating in environment protection activities, etc. The last 2 years of COVID-19 pandemic began with an anxiety, shock, fear, major setback, but we soon geared up and adjusted the pattern of work in the community as was required in different states and localities. On 3rd February 2020, along with the newly elected Secretary General Kuljit Kaur and Honorary Treasurer Rehana Begum, I took charge as the President of AIWC in a wonderful ceremony with blessings and good wishes pouring in. I was all geared up with plans of fulfilling my dream of taking AIWC to a greater height, at the same time fully aware of the challenges that we would have to face in the process. We were just settling in with the stories of coronavirus started coming in. With the virus spreading like wildfire, the entire nation went into a sudden lockdown from 24th March 2020. It hit me like a bolt from the blue. I finally realized that this was a new and unheard of challenge that I have to face, but not on one to bow down, knowing that the pandemic had created significant unprecedented challenges for all the leaders across the globe. Major setbacks we had were loss of parents and dear ones, loss of jobs and pressure of paying EMIs, insomnia, anxiety, emotional trauma, less concentration on studies, public transport shutdown in pandemic and paying a hefty amount of cabs for transport by cabs by a healthcare worker who had to travel daily, loss of education, increased the prevalence of mental health issues, no help received from relatives, purchased costly medicines. I decided to take on this new challenge with determination. I decided to plunge headlong into the situation, bearing in mind the safety of all the residents at the campus. This is our campus. Any challenging situation? Although the first phase and the second phase, the office was running. All through the first phase and the second phase, the office was running regularly, except for the lockdown imposed by the authorities. There were hardly any buses or regular metro services, still the staff managed to come to the office. The mess for the working women who were staying in the hostel was running regularly. The mess manager would take time to go to the market and get necessary items so that the kitchen could run regularly. Distress Women's Home was also running regularly, and the young girls were kept busy in the indoor activities like gardening, drawing, painting, etc. to keep them busy. At times, we arranged for music and dance also to make the life interesting. However, the sanitization of the building was done regularly. The staff members and the girls staying in the hostel and short stay home were checked with pulse monitor to keep a record of oxygen saturation, and the temperatures were also regularly taken. Here you can see the girls from the Distress Women Center shelter home. They are cleaning their premises. Some of the yogic exercises were also given to them. Few more pictures will elaborate on the activities carried out across the country by AIWC warriors during this highly challenging period. Thousands of masks were stitched and distributed regularly by the members. Chemical-free sanitizers were prepared. Tons and tons of variety of food items were prepared at home or at the branches and were distributed to migrants and poor, needy people. Any other required items were also distributed free. Free medicines, RT-PCR tests done, medical help was also provided. Here you can see the mask being done, stitched, and the sanitizer, some distribution of the mask and the needy articles are being done here. Distribution of medicines, some needy articles at different locations all throughout the country. It was done by our branch members. RT-PCR test being done. Prayers are also being conducted. Caring and lodging and boarding facilities of frontline COVID-19 workers who are the employees of the government of Gujarat had been entrusted to ARWC Rajkot. More than 70 medicos have been given allotment at the hostel for the working women managed by ARWC. Counseling services were also given. The pandemic scenario had been a source of great hardship on the mental health and well-being of many. A counseling center managed by ARWC Rajkot had been working constantly for the mental support of those who need it through various platforms, that is telephone counseling, video counseling, etc. Vaccination drive, people were, they went door to door to tell them the importance of vaccination, and they were motivated. Even the transgender community was also vaccinated by our branches. Some more pictures of the food items. As I said before, women were had to face the atrocities at different places, different times, different locations. Some of our sisters, they have helped them rescue with the help of police. Any challenging situation brings in new ideas. A society survives best when interacting, sharing, and learning at the same time. With travel and social gatherings being banned, a new method of collective gathering, the webinar became the new order of the day. This new tool gained popularity very fast to communicate and also provide solutions. Head office did not let the pandemic bring life to halt. Regular webinars were conducted throughout the country, sharing new topics, new learnings. Life cannot be stagnant, it has to move on. And this is what our members did. They moved on, offering help to the needy and taking them along. A big salute to all the COVID warriors. Our community college at head office also faced lockdown. Children had to go through a big challenge because many of these community people, they do not have smartphones or laptop of their own to attend the online classes. But our teachers, they managed them. Right from the beginning, we had a positive approach to a whole situation, and we explained and created awareness for that among our staff members, about 100 of them, and arranged a series of lectures by renowned spiritual personalities on positive thinking to help the staff to come out of anxiety and depression and work in a comfortable manner. When our office was running, we had arranged for the classes. These people, they attended the classes and they gained from it. We have our quarterly magazine Roshni, and this time we had published a special issue giving all the details of this magazine. Now, moving on forward, we need a gender lens, whether it is data collection, design of policies, or execution of programs. There is need for a women-centered approach. Women have to be brought back into the workforce. All have to play their role so that the small gains achieved in women employment in the last decade are not lost forever. If first opening up of 2020 was marked by relief and the second with sadness, the third was marked by the sense of resignation. Proposals to handling COVID-19 situation for women. We are giving some proposals. Guarantee of proper health and nutritious services, support and protect the mental health of women and bring an end to gender-based violence, access to sanitation and menstrual hygiene, bridge the digital divide between men and women, working with government and NGOs to ensure the laws made for women are being implemented, providing advice and support through counseling, set up action plans for cases of abuse, set up action plan for COVID-infected pregnant ladies, women who are differently able, for example, women who are deaf will require sign language to understand the information about COVID-19, or women who are blind will need Braille to understand the notices released by government. Thank you very much. This is our team, Rehana ji, Kuljit ji, and myself. Thank you very much for patient listening.
Oh, thank you so much, Sheila. That is amazing. An organization that is so large, reaching all corners of India, that it's a sort of it's a role model. And thank you so much for all this.
Just a bird's eye view, Sudha. I could not, because of the time constraint, I could not show more.
I'm sure the others will bring up the points that you probably wanted to make. But thank you so much. This is amazing. Our next speaker is Dr. Bobby Nasser. She's the chair of the NGO Committee on Human Rights and represents the International Federation of Settlements and Neighborhood Centers, IFS, at the United Nations. As a mental health clinician, she's worked with refugee communities for over 3 decades, providing counseling to survivors of torture, human rights training, and leadership development. I've known her and her striking contribution for decades. Welcome, Bobby.
Thank you very much. And of course, the respect goes both ways with you, Sudha. So I wanted to say, though, that right now, I don't think we can understate how much this pandemic has hurt women all over the world, and including here in the US, because there was already a built-in structural discrimination. And when you have this kind of, let's say, extreme disadvantage to begin with, and you have a pandemic, it's a a perfect storm for setbacks. And so there have been statistics gathered worldwide, but let me talk about a couple of them. One is that right now it looks like women have lost a lot of ground in terms of gender equality vis-a-vis pay. So the gap was always there. It's grown tremendously. And I'll just mention a couple of factors. Women have always been the ones to pick up the slack in terms of caretaking and unpaid work, or it's sometimes called the informal sector. I think it's called the disadvantaged sector, because if you're not part of an income stream that's above board and you're getting paid under the table or whatever we want to call it, then you're very insecure. It's just built in. We know this because we all need to know how we're going to pay our bills and if we're going to be able to keep our housing and cover our food expenses. And women are almost always the ones who pick up all the slack. Okay, so it just got worse and worse and worse. The other place where it became, I think, beyond stressful is in terms of childcare and homeschooling. So I know we're all, talking about the positives, if one could say that, about technology, but first off, the people that had less technology were already the people that were less advantaged, right? So it just got worse. Then trying to take care of your children, not just in the ways you did before the pandemic, but during the pandemic, you were also trying to make sure that they were keeping up with their education. So the workload, if you just want to think about workload, became overwhelming, and I think has resulted in a lot of, especially women, I'll say more women than men, even though I like guys, it's been worse for women. It just has been worse for women. And so there's been a lot of depression, anxiety, pretty severe. And I think all of us have to understand this has always been a movement. The women's movement has always been a movement. And I think we need to really become more vigilant and more connected to each other. And the value of solidarity is immense. And those of us that have more have to be sure that we're there for those who have less and make sure that their voices are elevated. So this is the main thing I wanted to say. It's kind of more of an overview. I know we're going to hear specifics from the rest of the panelists. And I especially want to give a shout out to Mary because Mary has some very important examples of basically dealing with people that have been suffering a great deal. So that's it for me. I'm happy to answer questions or give you more information about more what's going on the international stage, and also in terms of how we all can use the Human Rights Network and the Human Rights Framework to advance our work. So great to be with all of you, and thank you very much for the opportunity.
Thank you, Barbie. Like, it's interesting, you know, what you brought out. It is so true. All the strides that women had made, any gains that were there throughout all these years, it's sort of, the COVID-19 seems to have taken that away. We need to see how many women get back to work and how many women will keep the, you know, keep the benefits and the salaries and all those things that they had gained before. We need to see that. And then this is happening internationally. I'm afraid. Thank you so much. Our next speaker is Kuljit Kaur. She is currently the Secretary General of All India Women's Conference after handling multiple responsibilities in the organization over the years. Her well-known expertise is on women's safety and women's rights, with a particular focus on sexual harassment in the workplace. I know her passion and commitment for women's empowerment and welcome her presentation today. Kuljit Kaur. Kuljit, you have 10 minutes or a little more. Thank you.
Thank you, Sudha, for being so kind. And Bobby, as always, you spoke really very well from your heart. And good morning and good afternoon to everyone, all the panelists and all those who are attending our program. So my maybe little bit more than 10 minutes. I hope Sudha will be kind enough to grant me some more time. My meeting. COVID-19, our worst fears are true. At CSW 65, March 21, we had taken up the topic of the impact of COVID-19 on women in India while they were working from home. Last time we had discussed this. We had shared plenty of feedbacks from the ground to show how existing gender inequalities had led to women suffering a far greater impact of the pandemic. Since then, many research findings from the field shows that our worst fears which have come true. As many as 43 million women, about 57 of working women in India lost their jobs in the pandemic. More than 15 million women either didn't get their jobs back or suffered 50% fall in income. Nearly 64 million women in low-income rural India cut back on their food because they couldn't afford it, feared they would be insufficient for their family, even when the Indian government undertook a massive program for distribution of food grains. Even then, the sufficient food was not available in the houses. Unpaid work by women, already higher than global standards, increased by 30%. Pre-pandemic unpaid work So pre-pandemic unpaid work by women like cooking, cleaning, and care, as Bobby has also just said, was 6.5 hours daily, 3 times more than men. Men, they work only for half an hour or 50 minutes, and women, they work 6.5 hours daily. This is the worst gender gap in India in the world. Mental as well as physical health issues affected the ability of women to work in India, and the impact was more severe than what was felt globally. According to a recent survey, this can widen India's already large gender gap. Less than a quarter of women in India are in the labor force. This is among the poorest rate in the world. They earn 35% lower on average than men. Women out of work, it's C session, we call it. The challenge was much more severe owing to the second wave, because second wave was worse than the previous one. The pandemic hit all the classes in one way or the other. It has especially taken a toll on women due to the extreme burden on the healthcare system and economic instability, which has resulted in an increase in violence, abuse, exploitation of women. The pandemic has been characterized as C-session, implying negative effects for women. It may be rather called a mom session. When schools and childcare facilities were shut down, mothers took on the brunt of additional unpaid care work and experienced labor and stress. After the pandemic, higher responsibilities of unpaid work were hampering women's re-entry into the paid workforce. Women with disabilities had to face a greater burden since additional efforts were required to ensure that their needs were being looked after. As we all are aware of this thing, for the disabled person, they need extra care. And since the care workers were not available, that's why the pandemic affected the disabled women all the more. And the children with disabilities, the same problem was there. The mother had to bear the brunt of that. They had to take the double responsibility of the elderly also, of the husband also, and of the disabled children also, because the schools also for such children, otherwise also the schools were closed, and women had to take the responsibility of taking care of all type of family members. Women in India suffered disproportionately. Second wave, from the low wages to job losses, slower pace of vaccination. As you know that in India, though the vaccinations were made over here, but so many vaccinations, they were sent outside the country. So that's why there was a shortage of vaccination also, and the women couldn't get those vaccinations on time. So they have been hit more severely than men in India. A number of women working on the managerial level lost their jobs due to manpower rationalization. When the manpower rationalization was conducted in the offices, the worst affected were the women, because women were the first one to lose their jobs. Women have a drastic fall in financial independence also, because they lost their jobs. So that's why financial independence was also lost for the women. According to Nudge Foundation, women reported more than 76% reduction in weekly income due to the lockdown. Because the salaries were reduced, there was a loss of jobs also. So that's why the financial independence was also lost. And what was the solution? They had to dip into their savings and faced issues related to food and health. While there was a strong government response through free distribution of food, it was a question of dignity and self-respect for the economically independent women to wait in queues. So that was the psychological impact on women. Though they were financially independent once upon a time, during COVID, the wages were reduced, the jobs were lost, they had to get into their savings. Though the government had come forward to help by giving, distributing food and all, but women, those who were economically independent, it was against their dignity to stand in the queues and ask for free ration. Of the women who owned their own business, now what was the condition of the other women? Those had their own business, those who were entrepreneurs, 72% negatively impacted due to COVID. Women owners of business in customer-facing sectors like handicraft, textile, food processing were hit hard because the physical markets were closed and they were also unable to sell their products because the lockdown was there, the market was closed. Though they were preparing the things, the textile, handicraft, all those things, but they were not in a position to sell those things because they couldn't get in touch with the customers. Messieurs, domestic help and beauticians who provide service in physical proximity suffered due to COVID restrictions and fear of infection. So all the women, whatever category they belong to, maybe high professional, businessmen, entrepreneur, caretakers, service providers, all of them, they had to face this financial loss. Now, impact on women's health. This is very important. All the time we are talking about the financial loss, extra burden, domestic violence, but we are not worried about how it impacted the health of the women. Field research shows severe impact on women's physical and mental health. We should be talking about the mental health of the women, I think. Pregnant women have been specifically excluded from many treatment and vaccine trials because the pregnant women were not supposed to be vaccinated during this COVID. Women's choices were severely affected. Her right to her body was denied because unwanted pregnancies, infection in the body, no contraceptives, no pads, she had no right on her body left anymore. Nutritious deficiency and lack of nutrient diversity had hurt women. There was no nutritious diet, she couldn't afford that, and there was no choice for the nutrient food also. Nearly 17 million women could no longer afford menstrual pads. There is enough qualitative evidence that says increase the incidence of infection damaging women's health. Because in the absence of pads, the women had to use the rough and dirty clothes to save themselves and protect themselves. More than 33% of married women couldn't access contraceptives, as I have all told you. Women's mobility, already low in India, was further hampered by the pandemic, cutting off women's access to healthcare, employment, and government services. There were unintended pregnancies also, so women became more vulnerable. They found it difficult to access government support services and resources with severe impact on their all-around health. Experts mention that migraine amongst women has increased tremendously as the pandemic took a severe toll on them. Detection of HIV was impacted greatly. The information says that there was a decrease in HIV infection, but the reality is that there was no detection, there was no arrangement to detect and to check whether the person were infected by HIV/AIDS. As per hospital data also, it hampered cancer treatment, resulting in delay in seeking care. All this has been pushed back due to the lack of facilities in hospitals. There was a reduction in the cancer surgeries also as compared to 2019. So women, those who were suffering from cancer, they also couldn't get the immediate help from the hospitals. Now, mental health. There was hardly a family that didn't lose a dear one. Healthcare facilities and hospitals collapsed. Family members found themselves helpless. There was shortage of oxygen, of beds in the hospital, lack of space at cremation grounds. There were long queues to cremate the dead. Bodies of the COVID affected were not handed over to the families. They were wrapped in a sheet, and that was the last the family could see. This is what was happening in the hospital. Those who were dying of COVID, their body was not handed over to the family because of the fear of infection. They were just wrapped in a sheet, and they were shown from a distance to the family that your member is no more living. As in other cultures in India also, the last rites of the departed, prayer services, tributes are very important. The grieving was denied, all that owing to COVID restrictions. This caused depression and a deep feeling of loss for the members of the family. All this without any emotional support. Even prayer houses were closed. There was no spiritual solace for the family. You could see in newspapers, obituaries, prayer meetings of father and son on the same day, at the same time. Thus, the women lost both earning members of the family in one go. Imagine the plight of those women where father and son, they are dying on the same day, and their condolences also on the same day. As per official figures, about 4.5 lakh people lost their lives to COVID in India, but estimates by certain researchers place the figure much higher. They're talking about 15 lakhs and above. 19 lakh children in India lost at least one parent to COVID. All this severely impacted mental health and increased the anxiety and depression. The pressure of job loss, family responsibility, care for the ailing have increased the stress on the women's mental health. Women between the age of 23 and 40, since they couldn't go to the office without knowing their colleagues, they were working online without even knowing their faces. Social skill had taken a hit. 2 years of death and devastation and adapting to new normals had left a mark on one of the fundamental activities of the society, that is conversation. There were no functions, no weddings, no get-togethers, and the only conversation which was being done, that was about COVID. Whenever somebody used to talk on the phone, they will just ask, everybody's fine, there's no COVID in the family. So the most important social skill, conversation, that was also sadly lost during the COVID time. Women are at the front line of healthcare services in India. Over 80% nurses and midwives are women, making them more vulnerable, because every day they are coming in touch with the COVID-infected patients. Dealing with the fear of contracting the virus and the worry that who will look after the families had created a real crisis. The grief, managing fatigue was the major cause for mental health issues of individuals across all ages and all backgrounds. Under these circumstances, where the couples are forced to stick together, it resulted in domestic abuse, violence, and cases of depression, insomnia, suicide, and ultimately divorces also. Women were vulnerable to the pandemic-related crisis due to gender inequalities. The lockdown imposed saw an increase in divorce cases also, resulted in frustration, anger, and increase in child custody cases. National Commission for Women had registered 94% increase in the complaints of women being assaulted, but we don't know how many women couldn't even come and report the matter, and that matter was kept under the carpet. She was trapped at home, didn't know with whom to talk, with whom to share about her problems. 10 million girls globally had to drop out of schools due to the pandemic. In the age group of 11 to 14, 1.6 million. This risked the early marriages, pregnancies, trafficking, and violence of young girls. During all these years, I'm sorry to say, what was achieved in gender equality, empowerment of women and girls, fundamental freedom, right to development, all that has been set back, even reversed in many areas. Whatever we had achieved during all these years has been lost again. AIWC conducted an online survey by email, and this is the result. 61.8% of women and girls indicated that the second wave was more traumatizing. During the second wave, emotional stress, physical and mental health issues were identified, and 39% of women lost their jobs, overburdened, no incentives for extra work, and low attention span. What was the emotional condition? Anxiety, sadness, depression, and loneliness. This is the result of the survey which AIWC had conducted. Now, the Secretary General, he also said that in every corner of the world, we see an erosion of trust, and I fear that we are seeing the emergence of the twilight of shared values. Injustice, inequality, mistrust, racism, and discrimination are casting dark shadow across every society. Therefore, we must restore human dignity and decency and respond to people's anxieties with answers. We all have an obligation to speak up and act to put up the fire of human suffering. So there was so much of mental distress and impact of the health of the women that even WHO also responded for that, and they fixed 6 priorities to help the women and to bring them to a good health. The positive step that highlights the interconnection between violence, physical and mental health of women, and breaking the glass ceiling in health and science. First priority is address gender inequality. Second is elevate position of women in the health and care workforce. Protect those who protect us. And the third was prevent the response to violence against women. Because as I said previously also, most of the staff in the hospitals, in the health system are women. They are the attendants, they are the health the visitors, they are the midwives, and the violence that's why against them is too much. So we should prevent and respond to their violence. Ensure quality sexual and reproductive health for all. Access to contraceptives also, positive pregnancy also, support for violence survivors also, and reduce non-communicable diseases among women. Because women are the victim of 3 out of 4 women out of this non-communicable diseases, which is the cervical cancer, breast cancer, obesity, and physical inactivity. So now increase women's participation and leadership, because majority of the women in the hospital are the women, majority of the workers, but at the top, the leaders are men only. So therefore, we should break the glass and bring the women in the leadership capacity also. Now, though we are talking about darkness, sad side, negative side, there was some bright side also to this impact of COVID-19. As all doors closed, women used their innate ability and creativity to find alternative means to resolve economic issues. What were those? They used social media and technology to market their skills. Language teacher took to YouTube, cooking skills, baking, healthy salads, fitness, and yoga were among the skills that were sold using digital media. Of course, baking became very popular amongst people, and women, those who didn't know even ABC of baking, they also got into the profession of baking. Indian government's response was also quite positive after second phase. Cash transfers and free distribution of food grains, employment program for villages in the rural areas, domestic violence shelters and support services were classified as essential. 700 one-stop crisis centers were functional, supporting 300,000 women victims. Now, one-stop crisis center means at one place under one roof, you get the doctors also, police also, and the legal help also. So women, those who are victims of rape or domestic violence, they don't have to go from one place to another place to get the help. Credit support for self-help groups and special trains for the migrants. All this help was given by the government of India. Now, what is the way forward? I don't think we are appreciating the invisible psychological and emotional ways in which the pandemic has changed us. The way forward requires far more considerate, careful, and sensitive approach. The socio-economic toll has a long-term effect on women and girls. Policies now, the new policies and actions must target and invest in women. Otherwise, the exodus from the workforce will become permanent, reversing gender equality gains and GDP gains. Those women, those who had to leave their work, those who are left out, they must be brought back in the workforce in order to improve the GDP of a country. Investment in education, family planning, maternal health, digital and financial inclusion, and correcting the burden of unpaid care work. That is very important. We must recognize the unpaid care work by the women, because this will help create millions of new jobs and economic opportunities. Women's path to re-entry into the workforce can be made steeper. McKinsey's research. During mass disruptions like COVID-19, civil society and government relief programs have to be gender sensitive and women centered. Now, this is what, and much more I wanted to say, but because of the time, I'll stop over here. Thank you so much for listening to me. This is the time to wake up and spread happiness, break the bias, break the ceiling, and break your silence also. Come forward and be a warrior, be a part in the progress of your country. Thank you so much for giving me the time.
Thank you, Kuljit. Oh, what a comprehensive, in a very short minutes, you brought out so much of the work that's being done, and you brought out the issues in India in a very comprehensive way, and came up with all those recommendations also. But the next speaker, for instance, will bring up, we will see how the issues are almost the same, right? Like whether it is India or United States or other countries, they're almost the same, right? There may be a little bit of difference. And so I'd now like to invite Mary Archana Fernandez. She's the Director of Family Support Services at South Asian Council for Social Services, or SACSS. Her skills as a licensed clinician and her compassion and leadership have been extraordinary in providing the crucial counseling and support that women needed during this period. Welcome, Mary Archana. You have 10 minutes.
Thank you, Sudha. Thank you, everyone. And it's such a great pleasure and honor to be here and talk about all the work that we've done at SACSS during this very crucial time. And I just want to borrow a few words from Sudha that just said that if we talk about our work, we'll see that there is so much similarity on the status of women or everything that women have been undergoing, whether it's India or it's the US, or when we hear from the other speakers, we'll know about what's happening in other parts of the world as well. I'm Mary Archana Fernandez. I'm the Director of Family Support Services here at SACSS, South Asian Council for Social Services. We are a community-based organization based in Flushing, Queens, New York. At SACSS, our mission is to empower and integrate South Asian and other underserved immigrants into the economic and civic life of New York. Our core services are healthcare access and outreach, senior support services, food security, supportive counseling services, connection to government benefits, legal information clinics, and free English and computer classes. In 2021, we served over 50,000 clients through our different programs, and all our programs are free. A majority of the people that access our services are women. And as we all know, and we've heard from the speakers before me, that when women do well, we as society do well. We've heard about a lot of data points, and we all know that women made up 46% of workers before COVID-19. But if you look at all the unemployment data, it indicates that women make up 54% of the overall job losses. And when we are talking about job losses, we're talking more about the formal sector, but there's a large part of women that are working in the informal sector or doing a lot of part of the workforce that's not always counted. And as we are now in a phase where we are talking about regaining of jobs, getting back into the swing of things, Department of Labor statistics, at least in the United States, showed that while male workers have regained all jobs that they had lost during the pandemic, women workers have only gained 188,000 jobs as of January 22. We are still short by more than 1.8 million jobs that we have lost. And there are a lot of reasons for this. Some of the reasons the expert speakers that went before me spoke about it. And what I want to talk about is what we are seeing at SACSS, what we're seeing among our clients. A lot of them were even before the pandemic, right? They were employed in the informal sectors as babysitters, as cooks, so that other people can go to work. But when the other people were at home, these people stayed home too. So the first people to get pushed out of their jobs were the babysitters, the cooks, all these people, the caregivers, a lot of times the home health aides. A lot of times these people were the first people that lost their jobs. And they were, most of the women were the first to be hit during the pandemic. And they're also the ones in which the recouping of losses or regrowth has been the slowest. Also, most of the data shows that women with no college degree experience the highest job loss and continue to face huge challenges while trying to rejoin the workforce. What happened with a lot of women that are undocumented is when they stayed home, people did not need babysitters or people who cooked for them. And now these are the jobs it's becoming difficult for these jobs to come back, because a lot of people in the formal sector are still continuing to work from home. But as Kuljit before me said, that a lot of women that lost jobs were not in jobs that could be worked from home, whether it's the retail sector or whether it's the babysitters. They were people that actually need to be in present. I want to share a story of one of our client who worked as a sanitation worker, cleaning worker in a hotel. And I think it was sometime around March 15th or March 16th when we went to the first lockdown. She actually lost her job, and pretty soon her husband got COVID and passed away of COVID. So she was now with 3 children and no income, and her husband was one of the primary caregivers, making more money than her, passed away. So she did not really have any technical or formal skills to get back into the workforce. And there was the grieving that was happening for the husband. So when she contacted us at SACSS, we of course helped her make sure that she was connected to healthcare benefits. We provided her some supportive counseling. We were even able to find her a job at a local small business. It was not much, but it helped her family tide through that very, very difficult time. And now while she was able to get her job back, she was working 40 hours a week for 5 days a week. She's now only working 3 days a week for about 21 hours. So that is another thing, that when a lot of people are getting these jobs back, it's not at the same level as they were before. When small businesses, as we saw, as I said before, a lot of times when small businesses or any of these delis or stores had to lay off, often women were the first to be laid off. And a lot of times that, women even resigned voluntarily because they were probably the partner that made the less amount of money. So it made sense for them to stay home to take care of the children. But now when they are transitioning back to work, a lot of times employers are not sure if they want to work. Also if they want the women back to work. Also, a lot of these small scale businesses, they're not sure if they can have the same amount of employees that they had before. We don't even know if whether a lot of these small scale businesses are going to reopen. So a lot of these jobs have been closed down. Also, during the pandemic, we saw a lot of fallback on traditional gendered caregiving roles. While some families came up with unique strategies, still, as speakers before me said, a lot of women did end up doing both the work from home as well as doing a large part of the caregiving. So, for instance, another of our client that worked as a physician's assistant stopped working because the children were homeschooled. So she had to, initially for a week or two, she was working from home, but it became very, very difficult for her to work from home as well as make sure her children were logging into their database portal for getting online classes. So eventually she had to drop out. And now, when the children are kind of going back to school, she has been trying to look for work, but it's very difficult. With long periods of unemployment, many women are now finding it harder to find jobs. Also, upon finding a job, many of them feel like they're not able to earn as much as they once did. Balancing work and family obligations has long been the reality for women in the United States. But as we heard from the other speakers before, it's probably the case all over. Historically, women have been primary caregivers in their family, and this has remained true even as most women work outside the home and provide important contributions to household income. In terms of SACSS, we saw a lot of women apply for low-cost insurance as they lost employer-based insurance, health insurance. Many became dependent on food pantries. To give you an example, prior to the pandemic, we were serving 800 families at our food pantry, but now we are serving over 1,300 families per week. And as I said before, majority of the folks that access services at SACSS are women. Also, being employed in the informal sector means a lot of times women do not have access to safety net programs such as unemployment benefits. A lot of our clients, especially if they were undocumented or if they were working cash jobs, they were unable to get that unemployment benefit, which could thrive them, help them and their families tide over that difficult time. Pujit spoke about emotional health. The emotional health and toll on women has been severe. Anxiety, isolation, loss of self-esteem. When we feel confident, we do better. A lot of times women now are experiencing confidence issues, loss of self-esteem. Will I be able to do or work at the same level that I was working at the same level before the pandemic? We are getting a lot of instances of domestic violence. We're seeing a lot of reported cases of domestic violence with people being together, intimate partner violence, people being together in cramped up spaces for a really long time has increased issues of domestic violence. So what are some of the recommendations? Maybe here are some things that might help. More investment into sectors that are dominated by women workers, which include the healthcare giving, home health aid. That's a business or an industry that's heavily female oriented, female dominated. Support for small businesses, maybe tax incentives for small businesses that hire more women. Education to women on asset building and financial management. A lot of times we've seen that a lot of our clients, they're unaware that, if they file taxes, they can get Social Security benefits at least at a later age or when they are unable to work. So a lot of times women do not know of these kind of things. So education around this would definitely help. Job training and technical education for women. At SACSS, we have computer classes, and a lot of our women patronize these computer classes. So they're able to get, move up in that job market, get more additional professional skills. Support in terms of childcare. Childcare remains largely expensive in the United States. And a lot of times that's the one big hurdle when women want to go back to workforce. So assistance with childcare vouchers and making childcare more affordable, I think would be of great help. So thank you so much. And thank you, Bobby, for the shout out. Thank you, everyone.
Thank you very much. Like as a SACSS person myself, I'm sort of personally know what is happening. And just as we know that all the work that's being done by AWSEU. We can't really, talk about everything that's being done. The same thing with SACSS. This is enormous, though. This, what we've had to do, how we've had to pivot to doing things in a different way. It is enormous. Thank you so much. I'm going to sort of change the order a little bit here because we have two people from the Caribbean, and I think before we go to Asha from AWC, if you'll permit me, I would like to introduce Bibi Shaniza Ahmed, who is from Guyana. She is a domestic violence survivor herself, and she's the co-founder and CEO of We Care Guyana. Her career is centered on social change with a focus on ending gender-based violence and sexual assault and empowering women and youth, primarily at the grassroots level through advocacy and community outreach. She's a trained psychologist and brings a wealth of experience to us today. Welcome, Bibi.
Thank you. Namaste. Salam. Good morning to the panelists and your other viewers. Thank you for having me here. Well, going after the other speakers is a little bit challenging, but I'll make it brief because you don't want to bore everybody. COVID-19 really hit Guyana the same time when we had election impasse. Some of you may be aware, some may not be aware, but we had a huge election impasse. So that had negativity on the population, in particular women. So we had two factors at the same time. It was quite challenging for grassroots women. One of the biggest problems with grassroots women here in Guyana is accessibility to internet service. We don't have much internet service. So communication, that's what we had to use communicate. It was really minimal. It's still, but it's a little bit better. There were so many challenges for women, men also too, but I did specifically mostly with women, but I don't discriminate. If a gentleman come to our organization, we will certainly try to help. But let me give you an example of what happened to a woman. And there is a mother, she's living in an abuse. I'm not gonna call name or so. She's poverty stricken. Her husband does fishing at the sea. There was a lockdown, so there was no fishing, so he stayed at home. He's an alcoholic. So whatever little money he had at home, he buy alcohol and drink it. When he doesn't get it, he abuses her. Physically, emotionally, all forms. Even sexually, she was abused. For her to communicate with me, she had to wait until he's sleeping like wee hours in the morning. She would call me. I would give her some psycho support. I could not physically go there to help her or remove her. That's just one example. When the full lockdown was slightly eased up and the government had started to give cash grant and they gave essential workers. They gave each household here in Guyana got a cash grant from the government, which helped. It wasn't of the best, but I think everybody's thankful for it. I only could speak for myself on that part. But what we at We Care did, we network. We try to get computers, tablets for children who could have do work from home. We got food supplies, we distributed, and we had to do an appraisal to know who we could have given to because we couldn't give all. So we network private sector here in Guyana. There's some private business here in Guyana that help. We had to get masks, we had to get sanitizer. There are so many things. The elderly women who live by themselves, we had a huge challenge to reach them, to communicate with them, to know their needs, but we tried. It was really challenging. It was scary too, because if you go into an area, you don't know who has COVID, even though you wear your mask. You don't know what could happen to you, but you tried, and you know, with God's guidance, you were able to help. I won't go into all the details, but here in Guyana, women, 1 out of 3 women reach some form of abuse. I think that there's a new stats going to come out sooner or later it's going to be 1 in every 2 women that is being abused in some form. We have huge challenge here in Ghana where gender-based violence is concerned. My organization, anybody who reach out to us, we offer free counseling. We give free counseling. Now the restrictions have been moved, so our office will be back in operation whereby people can come or we go to them, because some of them cannot afford to come use public transport or private transport to come to you. So we would go to them, see what have, and I also network, because one organization cannot do the work here in Ghana. And network with civil society, we network with government. Even up to last night at 10 o'clock, myself and a government official was trying to help a victim come out of her home, a young mother. She's just 19 years old and she's living in an abusive situation with her child. We were trying to get her. Unfortunately, she declined our help. We tried to work with her again today. Those are the challenges. And as a survivor, I understand the mindset of a victim. So I try to use what happened to me to help them to know that they can get out of that situation. And 9 out of 10 of those persons who are, we have the silent partners who don't say anything, but 9 out of the 10 persons that we help with our organization are poverty-stricken persons. So it's a huge challenge. I won't bore with all the details of the impact of COVID because I think the speakers before covered most of it. And it's similarly here in Ghana. And I thank you for having me on the panel.
Thank you, VB. And it's very touching, the stories that you told us. Yes, it's happening everywhere. It is true, but you also brought out how important technology is, right? Like it's become so important to our lives, and for an old woman who cannot get in touch with anybody. We know those instances also. Somebody who went sort of crazy when her cell phone didn't work. Like there are things like that. That's a lifeline sometimes. So thank you for bringing it out, and for all the other information you gave as well, right? And experiences. We would now go back to AWC. I would like to invite Asha Deshpande. She directs socioeconomic programs at All India Women's Conference. I've known her and her remarkable work for a long time. Asha's expertise is banking and finance and has served as treasurer of AWC before. Yeah. As such, her perspective on women at the workplace in the current environment would be valuable to us. Here is Asha. Thank you, Asha.
Thank you. Thank you, Sudha. Can you hear me?
Yeah, we can hear you.
Okay.
Sure.
I wanted to remove all this mode, whatever was there in the COVID-19 and all. And already you have said that I am in the finance. So I will talk on the empowerment of women in case of the financial position. First of all, thanks to everybody who had given me the chance to talk on this particular subject. First, I will first explain who is woman. Woman, that is W, is wheel of the family. O, that is ocean of knowledge. M is the mirror of children. A is address of love. And N is navigator of lifeboat. Introduction. As a social worker working with the Women NGO for the last 20 years and having experience in the financial field, it is observed that even in 21st century, there is no remarkable change in the women's problem, not only in India, but all over the world. United States Nations, York and CSW at United States, Nations, along with the member countries and CSW, which is an organization of member NGOs all over the world, are interested in getting the solutions to the problems and the issues of women. The special conference in Beijing was arranged in 1995 and discussed the issues which represents and known as Millennium Goals. Details are poverty eradication, microcredit, education, health, nutrition, drinking water, home and shelter, and environment. It was also decided that after every 5 years, the review would be taken, and the deadline was given as December 2015. It was the trademark year for the global development. The MDGs were not implemented in a true sense and were again discussed and changed, known as SDGs, that is Sustainable Development Goals. Sustainable Development Goals are also known as a global goals and is a universal call to action known as to end the poverty, protect the environment, reduce the economical inequality, ensure peace and justice for all. The 25th September 2015, the 193 countries members of UN General Assembly adopted the 2030 Development Agenda titled Transforming Our World. I was fortunate that I could attend UN Millennium Conference in 2000 at New York, then in 2010 and 2013, and the progress of issues was discussed. But as a member of Women NGO, it is observed that women would be empowered only when she is economically empowered. Further to add here that I could get the opportunity of doing research in the famous University of Pune in India related to the economic empowerment of women and have a degree of PhD in the study of role of SACSS, that is self-help group of women in skill development for tiny and small enterprises. One minute, please. Further to add that as a member NGO, it is experienced that our members are also facing similar problems since beginning. Hence, as per AIWC's aims and objectives, policies such as health, education, and empowerment, it was led to me to work on the topic mentioned above. While studying it, I could know lots of facts, and the most important is that an economically independent woman is a lot more empowered than dependent. These women get respect, status, and many more at home front and also at society. Concept of powerful working of SACSS. SACSS, that is self-help groups of women who are coming together, and the concept I will explain here for the powerful SHG concept. SHG self-help group concept. SHG plays a major role in poverty alleviation in rural areas, activity engaged in savings and credit, as well as other activities like income generation, natural resource management, literacy, child care. SHG help. 1 minute. Her social status is seen somewhat elevated the social impact, resulted in self-confidence, self-esteem, self-respect, uplift the living conditions. Small savings is in the group is the prerequisite of the members. The change found after joining SHG group in women members: increase in decision making, awareness of various programs and organizations like NABARD. All this has changed the attitude of male members of the family and convinced about the concept of SHGs. Almost all women are doing small business in groups or in person, but still there are some problems which are basic and needs guidance. There is an absence of suitable and appropriate systems for developing necessary skills required. There are issues related to training programs and also the knowledge about how to run the business. SHGs can develop schemes for approach towards the programs and different businesses. Skill development is the key indicator for the success and for the competition, strength, confidence to run the successful business. In India, the SHG concept is very popular and very powerful. Some of the financial results have shown here, that is 13, 14, 14, 15. During this period, I have made my PhD, so I am having the figures here. These figures are in crores, and we will find that because of this, these SHG groups have developed all over the country. Advantages of SHGs: financial inclusion. Banks are in favor of lending money for the assurance of returns by poor and marginalized sector of the society because of SHGs involvement. Voice of marginalized sector. SHGs have given a voice to underprivileged and voiceless category of the society. Social integrity, that is, SHGs help to eradicate many social ills such as dowry, alcoholism, early marriages, etc. Gender equality. By empowering women, SHG help the nation towards gender equality. These are some photos for AIWC's socio-economic programs. First is the Rajkot branch, second is Thitamangalam. They are having different types of activities. Rajkot branch is also having different types of material making and all. Then the third is the Shri Shakti Mahila Samajam, which is a constituent branch of Trivandrum. They are also making different types of things, and they are also having these solar dryer, and they are making some products from the solar dryer. This is a very small branch which I have shown here. That is the ornaments made by the branch from this coconut threads. These are the ornaments made by coconut threads. It's a very typical thing. Then there is a dairy project for Vijayawada. They are also running old age home. Old age homes we are having so many branches where the old age homes are run by the branches. Then this is a demonstration of making of this what we call is the sanitary pad. And here the second is Kakinada branch is having the sanitary pad projects with giving the help to the physically challenged women. This is another lady who is in the rural area, and she is a very strongful lady in the Andhra. She is making the prawn projects, that is aqua projects for the making of prawns and also selling. She is a very good lady and having so many programs with her. Action taken and the role of Government of India as a member country. Government of India took a note of the commitments in its 9th five-year plan by planning department, along with the other sectorial policies relating to empowerment of women. The women movement and the widespread network of non-government organizations which are having strong ground presence, are deep insight, have contributed inspiring initiative for empowerment of women. Democratic and secular India endeavors to provide conditions necessary for greater participation of women in the spheres of equality of opportunity is guaranteed. Discrimination on the grounds of sex, language, religion, class, or creed is prohibited. India is a signatory to MDGs adopted at the United Nations Assembly in September 2000. India was reformed MDGs and SDGs along with its own development and goals adopted and made significant progress towards its targets. But it is observed that the targets achieved are not uniform and consistent. Considering women's participation in decision-making at all levels, that is local to national, is negligible. Women's participation is an integral part of democratic process and for improving quality of civil life. Further, it is also observed that doing hard work and struggling for earning money by making production of various items, it is not as per the expectation and not acceptable at the market level. Schemes for women by Department of Women and Child Development. India is having a separate department for women and child development all over the country with all states. As India is having separate department for women and children, all over states, it is implemented by those offices. Schemes, that is Balika Samruddhi Yojana, Swadhar Scheme, Indira Gandhi Maitreya Yojana, Working Women Hostel, Support for Training and Employment Program, Ujjwala Scheme for Prevention of Trafficking and Rescue, Rehabilitation and Reintegration of the Victims Trafficking, Rajiv Gandhi Scheme for Empowerment of Adolescent Girls, Scheme for Short Stay Home, Integrated Child and Protection Scheme, Gender Budgeting, Kishori Shakti Yojana, Early Childhood Education for 3 to 6 Anganwadi. Government of India has taken positive steps to empower women. Safety
Asha,
initiatives like
Asha,
yes, yes.
I think you forgot to share your screen.
My?
Of course, yeah, you didn't share the screen. Of course, you were saying you were, yeah. We heard
I have
you.
shared my screen. Huh?
We heard you.
You can't see? You can't see
no.
PPT?
No, no.
No?
No.
So far?
Yes.
Oh my goodness.
Okay.
So
just
what
very quickly show. Can you do it? You think? Otherwise, of course, we got the gist of it, but we couldn't see the pictures. Yeah.
One minute. Let me share. Can you see this? Hello?
Not really. No, we can't.
Not?
No.
Oh my goodness.
Never mind.
No, I can't help.
No, that's okay. Go ahead. We got the, we got the information.
Okay.
Go ahead.
Mahila Uddam Nidhi Scheme, Annapurna, then Shri Shakti Package for Women Entrepreneur, Bharatiya Mahila Business Bank Loan, Dena Shakti Scheme, Yogini Scheme. Addition to this, Ministry of Micro, Small and Medium Enterprises, known as an engine of growth of country, also have separate schemes designed for women business. Though there are so many schemes designed by the various departments of government, these schemes do not reach to the people due to lack of knowledge and skill. Hence, our Honorable Prime Minister has a vision of Make in India, in which he, with the help of Planning Department, designed different types of skills development programs from grassroots to high level. Make in India concept to increase manufacturing sector growth rate to from 12% to 14%, to create 100 million additional factory job in the economy by 2025, to ensure that manufacturing growth contribution to GDP is increased to 25% by 2025. Though the nation suffered due to COVID and other calamities, the program of Startup India is going to change the whole picture of Indian market. The increasing pressure of women entrepreneurs has led to the change in the democratic characteristics, business and economic growth of the country. Women-owned business enterprises are playing a prominent role in the society, inspiring others and generating more employment opportunity in the country. There is a need of suitable growth of women entrepreneurs to protect a balanced growth in the country. Startup India is committed to strengthening the women entrepreneurship ecosystem through policies and initiatives. The monthly allowance for startup with the women as a founder or a co-founder shall get ₹20,000 per month for the year. Though so many schemes, facilities are there, because of there are lacunas in the reaching to the general public, especially to women. Still, women have captured the business of food products, articles made from the different material like coconut shell and even other waste material, artificial jewelry and so on. There is a international market for Indian food and also all types of spices, metal and other types of jewelry, various types of crafts and agriculture products. The women as a group in participating in skill development programs and also now well conversant with the frequent use of mobile phones, even at the grassroots level. 99% women are using mobile phones. I have this figure from my survey. The government also arranged various types of exhibition at the international levels and have kept reservation for number of stalls for women entrepreneurs. Summing up, as seen above, different sources of skill development, financial availability, and the government showing keen interest in developing women entrepreneurs, we are confident and sure that women empowerment will change the scenario of present situation of the country and the growth in GDP. As for making the progress, sky is the limit to achieve the target. Thank you, Dr. Asha Deshpande.
Thank you, Asha. Right, to bringing the economic and financial perspective on this one. And thank you for all the recommendations as well. Right, now we go to our final panelist. She's from Trinidad and Tobago. Anila Bhagwat is the co-director of the Center for Indic Studies in Trinidad. She's a sociologist and her research interests include women and gender and transnationalism. As a sociologist and a researcher, her perspective from this region would be extremely valuable. Anila, go ahead.
Thank you. So I'd just like to thank all the organizers for having me on the panel. I appreciate it. But what I'm going to do is sort of give a general Caribbean overview. But of course, in the Caribbean, we're all little pockets that are a little bit different from each other. And I'm from Trinidad, and we're sometimes vastly different from everybody else in the way we function, how our society is made up, how our economy works. So I'll just give like a brief overview of the challenges that Caribbean women on the whole face, and then I'll zone in on Trinidad in particular. So my screen is just going to be like the points that I intend to talk over. Can you guys see?
We can see, Anila.
Yes.
Yeah. Okay, cool. Yeah, okay. I just forgot how to put it on the presentation mode, but that's okay, right? You could see, right?
So I'll give you a general overview of what our COVID statistics have been like. So the CARICOM region is made up of roughly a population of 18 million people. And COVID stats have been close to 400,000 cases and close to 9,000 deaths. But these stats are from November 2021. And Trinidad in particular, our caseload did not rise drastically until late December 2021 into February of this year when the Delta variant hit us. So the figures here are going to be off by a lot. But in terms of vaccination, and this is the struggle of the Caribbean region, is that although most of our CARICOM nations had signed into the COVAX scheme to obtain vaccines, that had been initially a very slow process of obtaining vaccines, and we had to rely on donations from India. So some of the vaccines that you all weren't receiving in India, we were grateful for that they were donated to us, in the region, because that really kick-started our vaccine campaigns regionally. In Trinidad in particular, we did not have vaccines until the Indian government gave us, I think, 40,000 doses of vaccines like mid last year. So these are stats in terms of our COVID numbers. And generally, the most pressing concerns for women in the Caribbean is the fact that from March of 2020, that the sector that dominates the Caribbean, that is hospitality and tourism, has been totally shut down. And in Trinidad in particular, our borders were closed up until July of 2021. So there's nobody coming in, nobody coming out in terms of tourism, and women dominate the hospitality industry. So that's where layoffs are concentrated, in the hospitality industry, in food and entertainment, and in the retail sector, which had long periods of closure. Again, they're female dominated sectors, and women were the ones who faced the brunt of the closure of these industries. So women are concentrated in the informal sector, especially around domestic work and around sanitation. And domestic workers were one of the first to be affected. Our government did not allow people to have domestic workers work in their homes during the quarantine period initially. And then things like public transportation and so on were restricted. So movement of people who were working in the health and essential services, and women dominate again the health and essential services sectors, but usually at the lower levels. And things like transportation costs for nurses and so on are what will affect them in their movement to get to their jobs. We're talking about people like who work in pharmaceutical, like drugstore chains. So we have big drugstore chains in Trinidad, one or two, that employ a lot of female employees. These are essential services. Our grocery stores that employ a lot of female employees, again, essential services. These women have to go and come from work in a time where everything is closed off. And taxi fares, and well, we have maxi taxi fares. That's like they're privately owned, they're not really public transportation, so the prices are a little bit higher. The cost of fares increased as well. The taxi operators increased their cost of fares. And again, high concentration of women employed in the education sector. And then having to balance the work-life balance of having their kids at home, and they have to teach online. And up to now in Trinidad, our primary and pre-primary schools are not open. Our secondary schools are only started opening in mid-February. And hopefully by April, primary schools may start opening, but it may not be every day. It may be a couple days a week. So kids are still at home. They're still at home. Parents are working from home, and now parents are going back out to work. So where's the childcare expected to come from when parents are going out to work? Women are starting to go back to work. Those who have, who were working from home before, and children are still at home. So there's this kind of, who is supposed to take care of kids? And that's where you start relying again on the informal sector, that there are women who support the careers of other women, right? And these women are usually the most vulnerable women in our society. Trinidad in particular, and I can zone in on our problems, we have a lot of Venezuelan migrants coming across our border because of the crisis in Venezuela, economic and political. They are largely employed in food and entertainment, in retail, in agriculture, but also as domestic workers, domestic employees, because people can pay them a lot less than they will pay Trinidadians. And they do not have to account for these migrant women in the same way that you have to account for local Trinidadian women and that you employ. So that's another risk factor in Trinidad, and that's the risk of that Venezuelan migrant women face in Trinidad in the spheres that they are employed in. And well, when our government did make a COVID response team, out of 22 members, just 3 of them were women. So we had an underrepresentation from the beginning, although our health task force did have a fair amount of women representing higher up healthcare workers and informing us what the policy is around health and so on. We have seen a spike in cases of domestic violence. In March of 2020, the domestic violence cases reported went up to 230, when in the same month in 2019, it was 40. So Trinidad in particular has seen a huge spike in cases of domestic violence and cases of domestic morbidities because of domestic violence. That in the year 2021, we've had 21 cases of women being murdered because of issues of domestic violence. No, in 2020, sorry, and in 2021, it has been 13. And along with cases of rise in domestic violence, a spike in reports of child abuse and child sexual abuse. And of course, this also has to do with the fact that who is taking care of kids at home, that the burden that I think all the panelists have spoken about has been placed on women. Caribbean women have reported that they feel that the burden of childcare, their burden of childcare has increased during COVID-19. Their burden of unpaid care at home has increased since COVID-19 started, but also when women are working in the informal sector, or when women are working in essential services at the lower level and they have to go out to work, who is at home with kids, we have a rise in cases of child abuse and child sexual abuse being reported every month. Generally in Trinidad, we do have over 4,000 cases of child abuse reported each year. We have a Children's Authority. They have given us those statistics. And in the past 2 years, those numbers have increased greatly. So like I said, schools continue to be closed in Trinidad. I don't know if people are really, well, I don't know if the state has really thought about how women are to balance and how parents are to balance their work and livelihoods with taking care of these children, especially in the way the economy has opened back up, where kids are still at home and parents are expected to be out at work now. So while the economy has opened back up, schools are basically still closed, and public sector workers have been out from January of this year. The public sector was closed for a very long time. They've been working from home. The public sector is dominated by women in Trinidad. The public sector is one of the largest employers of people, and especially at the lower levels, they're dominated by women. in that case, it means that women who work in public sector sort of have their jobs are secured. So that was one benefit, because that's what you get from public sector work, that your jobs are secured. And that, so, you know, so in Trinidad, we do have that, we have a fair amount of women who have gone through the education system, who have access to free tertiary education. And that our education stats for women are quite high. And this is reflected in both the private and the public sector. Doesn't really matter in terms of incidences of violence or domestic violence, which we still see that 1 in 3 women report that they have been the target of intimate partner violence. If you include things like economic violence and verbal abuse, it becomes 1 in 2. And this is despite high employment rates for women and high education levels for women. And now that they are stuck at home, you know, what is the situation around domestic violence that women are facing? What's the situation around violence that children are facing and witnessing in the home when they've been trapped there for the last 2 years? What are the further repercussions of the violence that children are witnessing in the home that they've been trapped in for the last 2 years? This is what we have to deal with in the future. And in all this time, schools being closed, the Ministry of Education in Trinidad has reported that 46,000 children have not accessed online schooling, which is a large amount in a country that only has 1.3 million people, right? That 46,000 kids have not accessed online schooling because of technological issues. Access to the internet is very expensive, and there hasn't really been any effort to lower the cost of that or make it widely accessible during the 2 years that kids have been home from school. So my other concern is, we know that in the Caribbean, we're matrifocal people, that even though the society is patriarchal, that families center around women and are organized by women. So childcare is intergenerational. If women are out to work, who's taking care? It's the mothers and grandmothers in their old age who have to bear the burden of taking care of kids. They can't always keep an eye on them. And then if 46,000 kids have not been in school, that means daughters are also doing some of that unpaid care work, right? Kids who should be in school are now taking care of siblings and having to shoulder the burden of the household on running on them while their parents go out to work. And I don't think that we have thought all these things through on a policy level at all, or what the impact that is going to be on people in the future or in years to come. So generally, this is kind of my overview of what's been going on locally here very quickly. So whatever questions I can also add in later.
Thank you, Anila. Some overview, I tell you. It's so detailed, it's so comprehensive. And you brought out, when you talk about child abuse, that really makes you think. Of course, we're talking about violence against women, but this is happening to children too. And you brought the question of, migrant women being taken advantage of as far as salaries and things are concerned. We call them undocumented here. I think that's happening to the undocumented as well, right? Like they're being paid less because they're being paid cash, and it's not, So thank you so much. And Usha, like it is now 9:44. We have only 16 minutes more, okay? So I'm so sorry, Usha. So you would sort of hurry up and sum up so that we have just a little bit of time for any questions that may have come up. I have great pleasure in introducing Usha Nair, who is currently the zonal organizer for AIWC and has served as the organization's treasurer and vice president before. She's been actively working in the areas of alternative energy and climate change advocacy and has been conducting awareness programs across India. I welcome Usha for a very quick summing up of the panel. Sorry, it's a challenging job. Thank you.
Thank you, Sudha, and namaskar to all of you. First of all, let me thank AWC, SACSS, and the NGO Committee for Human Rights for giving me this opportunity of summing up this panel discussion. And you have given me a very daunting task and reduced the time also, so I will try my best. I hope I am able to do justice to this very stimulating discussion that has been taking place. And the main takeaway that I have from the presentation by all these panelists is that the problems faced by women across the world are so similar. And the problems due to COVID-19 are so similar, because in all the presentations, we had some points which are common in all these areas, whether it is India, US, or the Caribbean. Everywhere women face the same type of problems. The past 2 years have been difficult for all of us. With the arrival of pandemic, life changed for everyone. COVID has been actually a great equalizer, whether rich, poor, educated, illiterate, young, old, everybody was affected, and all the marginalized people were affected more, as happens in all crises. So the existing inequalities got enhanced during this COVID, and that is what we have been listening from all the panelists. So we started with welcome remarks by the coordinator, Sudha. And then after that, we had Sheila Kate, President of All India Women's Conference. She explained in great detail with the help of a presentation what All India Women's Conference has been doing during this COVID period and how it has been helping women across the country, not only women, even migrant workers and the poor people, poor families, and concentrating on health, nutrition, protection against violence, reproductive health, help in different for differently abled, etc. And they continue the focus on these areas, and the tremendous work that All India Women's Conference has been doing over the years, it has only been enhanced during this COVID period, even in the absence of the freedom to move around and get things done. Next, we had Bobby Nasser. And she also explained that the existing built-in culture of discrimination has been made worse by this crisis of COVID, as happens in any crisis. And she gave some statistics. Women caregivers and child care, education, lack of access to technology, and workload, the overwhelming workload that women had, which was imposed on them during this COVID, has resulted in depression, anxiety. So we need to be more vigilant, more connected, and have more solidarity. That is the recommendation that she has put forward, which is, I think, very, very important. Unless all the women, we all stay together and we are vigilant and more connected, we cannot help our sisters who are in distress. So that was the message from Bibi Nasser. And next we had Kuljeet Kaur, Secretary General of All India Women's Conference. She highlighted the problem of women suffering greater impact, the greater loss of jobs, fall in income, cutback in diet, because they forego their diet for the family because of shortage of food, and unpaid work increased all over, and the low rates of women's participation in workforce, because she has given statistics to show how all these things have been very greatly affected during COVID, though even otherwise the things were not looking too good. And extreme burden of healthcare, economic instability, increase in violence, domestic violence and abuse, exploitation. So all these have resulted in severe mental trauma for the women. And so we need to reach out and help these women. Then the problems faced by business women, and then the health issues faced by pregnant women where they were excluded from vaccination. And then also the practical difficulties, how the women could not afford to have buy menstrual pads, and how that has resulted in infections and lack of access to contraceptives. And so all these things, even that the low rates of detection and treatment of major diseases. Then her presentation was very much in detail, and about the causes for the mental health problems, and about depression, lack of how lack of company and social skills, conversations and get-togethers, how absence of all these has resulted in severe mental trauma for women. Then she quoted the Secretary General of UN, who called for restoration of human dignity and decency, and how we all need to respond to the anxieties of humans. And she also listed the WHO 6 priorities for improving the situation. And the positive side that she highlighted was that women started using social media and technology to market their skills. And many women have come up very well in this way. And that was one of the positives that she had highlighted. Next, we had Mary Archana Fernandez, who explained the activities of SACSS and also gave a couple of cases which were very touching, how the women lost jobs and then they lost family members to COVID, and they were helpless in the face of all these adversities, how they reached out to SACSS and how SACSS was able to support these people in a small way and also help them access government schemes, and how things have started looking up a little bit due to all their activities. But she also highlighted how the return to jobs is at a very low level, and even incomes are being offered at lower levels. And many women left employment for childcare, but now they are very slow in getting back employment. And again, loss of insurance, surviving on food coupons, these have become the very common, and access to unemployment benefits is also reduced because they are not aware of the need to register and do whatever steps they have to take for accessing unemployment benefits. So the problems of anxiety, loss of self-esteem, loss of confidence, domestic violence, all these are common in the US as well. So what is required is more investment in sectors dominated by women, support for small businesses of women, and guidance about finance and technology. These will help women do better.
1 minute more.
Just two more people to. Bibi Ahmed of Guyana, she described the state of affairs in Guyana, which, as I said, is very much like any other place. But there, the main point that came out was the importance of technology, because access to internet is very limited in Guyana, and this has resulted in it has affected education, it has affected government aid, it has affected the health sector, and so again, she highlighted increase in abuse and all that, but they are offering free counseling, which is a very good thing. And network building is very essential for helping the distressed women. Again, she has also highlighted this point. Asha Deshpande gave a very detailed talk about how women have progressed from the time of the Beijing conference through the Millennium Development Goals and Sustainable Development Goals, and how the performance has not been so satisfactory, but how small efforts by AWC under the socioeconomic program and otherwise has helped women to come up, and how women's participation in decision making is very important. She also detailed all the schemes that the government is offering for helping men and women in this COVID situation. Unfortunately, we could not see her presentation, but then through her talk, we could understand the points that she wanted to make. And last, we had Anila Bagbar from Trinidad, who gave a Caribbean overview of the problems. And the main problems that she highlighted were the problems with childcare, of shared responsibilities, and especially the problems faced by teachers who had to take online classes and also look after the children who had to attend online classes. And then how the job security in public sector has helped, because many women are employed in the public sector, but then the problem is that childcare becomes a problem when mothers go to work, we look after the children and the elders at home. And she also highlighted the absence of discussion on these topics at the policy level. So that calls for policy to improve the situation in these things. So what I would just wind up by saying is that pandemic, we should not look at the pandemic just as a challenge. We must also recognize that it is a great opportunity. This is a rare opportunity to change the workplace for good. And it must be recognized that a woman's place is at home and the workplace if she so chooses. So we have to get support. Women must get support in their roles as breadwinners, mothers, caregivers, or any combination of roles that they choose. Organizations like SACSS and AWC must work hand in hand to improve post-COVID workplaces and improve them into places that guarantee equity, fair practices, equal opportunities, and pathways for advancement. So thank you so much. Let us all join hands to catalyze actions that will build more equal societies for the future. Thank you, Sudha. I hope I have...
Thank you, Usha, for raising to the occasion. I'm so sorry. Can we, Vix, is it possible to go on for another 5 minutes or so? Or will they cut us off? I don't know. Okay. I now would like to invite Navina Sitaram. She is the representative of All India Women's Conference to the United Nations. She is sort of mostly responsible for the logistics and organization of this panel. Navina.
Thanks. I think we have time for one question, and I'm going to ask this of all the panelists. If you could think of one thing, just one important thing that could help working women right now as things stand today, what would it be?
I think you start with the, as it started. I think Sheila, then Bobby, and the order in which they spoke. Yeah.
Sheila ji?
Sheila, you're muted. You're muted. Yeah.
You can tell it's COVID effect.
Navina, can you repeat? Yes, can you please repeat?
We can hear you.
No, she wants you to repeat the question.
Oh, I said, if you could think of one important thing that would help working women today with the, everything as it stands today, what would it be?
Muted again. She's muted.
I think you're on mute.
Okay. Are you?
Sheila ji, are you?
Can you unmute yourself?
Oh,
Kuljit,
no.
Can you unmute yourself? Kuljit?
Yes, yes.
Okay.
The one suggestion, Navina, I would give to the working women is don't depend on others, be self-reliant and be economically independent.
Okay.
That's what I would like to tell the working women.
Okay. And then I think.
No, that's a good one.
Okay.
So next we have.
Yeah, so
Bobby.
I love what you just said. And I think every woman in the world wants to be able to do that. I'm going to say that I think childcare needs to be free.
I think
as close to free as possible, because the burden on women when they're trying to make sure they're good moms is horrendous. So that's my one suggestion.
Yes,
wonderful.
can I say?
Oh, here we have Sheila G.
Yes, I will say that you have to face every challenge that comes your way. And you have to face it. You should not get scared or fear or anxiety. You should drive away all those emotions and face. You have to arouse the energies in a woman. You have to face all the situations.
That's great. That's a great suggestion. And I think we'll move to Bobby. Bobby spoke about the need for free or low-cost childcare. I think that's a very important point. What about Mary?
I would definitely say low-cost childcare as the mom of two very young children.
Oh, yeah.
But I also want to talk about female solidarity. I think that women, when we work together and when women do better, society as a whole does better. So more female solidarity. And thank you.
Oh, that's a very important one. How about Bibi?
Inequality. Women in the workplace, in particular in Guyana, there is inequality. We need equality. We need our recognition in society. That's all I want to say.
great.
That's a critical one that I think you touched on in your
yeah, it
well.
goes beyond the imagination, because here in Ghana, inequality in the workplace it's a big challenge. And I mean, there are systems in place to help, but in particular the private sector, the inequality is there and it's blatant. It's blatant. And I could go to another one, sexual harassment in the workplace. It's a big problem too for women.
Thank you. How about Ashaji?
You're muted. Yeah.
Yeah. I'm here. See,
one sentence.
Okay. Yes, I say that women are the managers of finance. So they should not worry about the things and they should sustain themselves and the family.
Okay.
That's very true.
What do you say?
I said that's very true. They are,
yeah.
they are the ones who
you.
manage all those things. Yeah. Yeah. Okay, we'll move on to Anila.
So I would say female solidarity too, especially along a class divide between women who are looking at careers, who have the ability to say, I have a career and I'm a career trajectory, and then the women who have to work so these other women have careers. That, and the other thing, of course, that will help in that is you need to re-educate men about what is their social role. So that's exactly what it is. And that's the only thing that's going to take a lot of this burden of care off of women. So yeah.
No, thank you.
Okay. Navina, thank you so much. Is that what you got?
I think we got to
everyone, right? Okay. Thank you so much, everyone. This was a remarkable, thought-provoking panel that provided such insights as well as valuable recommendations. Thank you, panelists, for your inspiring presentations. This was so touching. It'll be with us forever, I think. And thank you to the technical team, Bix Gabriel, for your support. Thanks to the NGO Committee and the Status of Women, New York, for the parallel events. Thank you all for joining us. We wish you the best going forward in a COVID-free world, we hope. Thanks, everyone.
Bye-bye. Thank you, Sudhaji, for all the help with Navina. Excellent support. Thank you so much, Sudhaji, Navina ji, Usha, for accepting the request. So
thank you. Usha, you had a very hard job. Thank you so much.
Can everyone stay on for just 1 second? We would like to take a picture, a big snap from everybody, please.
So I think everyone should be on video.
Okay. Okay, here we go. Okay, thank you, SACSS. Picture.
You took it? Done? Okay. Bye, everyone. We'll be in touch.
Thank you so
Okay.
much.
Bye.
Thank you.
Thanks to Sudha and everybody,
Thank
to
you,
you
Sudha.
and DSW, everybody
Okay.
who has
Thank you, Caribbean.
participated.
Thanks, everyone.
Yeah.
Thank you. Thank you very much.
Bye.
Thanks to
Bye.
all who listened very patiently, the
Bye.
repeated things about COVID-19.
Yeah, it's so sad, right? Yeah. We have 21 people here still left. Okay.
There
Yeah,
were 71 before.
71
There were
before.
55.
Yeah, 55. Now I think there are people who, hey, it's so touching. It is so sad though, right? Like, yeah, still so much to be done, right?
Yes.
So everybody is working so hard, right? Yeah, still, let's hope that women can get back what they had at least gained before, right? So
Yes.
yeah, thanks a lot, and we get to work. Okay, bye-bye
I'm
now.
sorry that my video, you should have told me before so that I could have done it before.
I didn't realize, then
That was a problem for me.
Okay.
But actually, whatever I wanted to say, I said it. But
You
I can
said,
send that.
and you described what was in the picture, so we knew what you were talking about. So, okay, yeah. So.
Okay.
All right. Thank you. All the best.
Thank you.
Okay.
If you see,
Okay, Asha, thank you so much.
Thank you.
Usha.
Thank you.
Bye.
Puljeet.
Bye, Navina.
Bye-bye.
Thank you, Sheila.
Bye, thanks, everyone.
Yeah.
Thank you.
Bye.
Bye-bye.
Bye.
I'll be in touch. Okay. Yeah.
Yes.